Here.
States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Do you mind that real quick? Okay. Just real quick, a little housekeeping issue. Policy 903 states that there is a maximum of 30 minutes at each beginning at the end of our meeting for public participation. Options would be to adjourn, have a special meeting, or put comments or speakers off until next month. We have no interest in doing that, and I don't believe. And so I want to make a motion to the board that we suspend this portion, this clause of policy 903, which would allow every person on the agenda scheduled to speak. So therefore, everyone gets their 5 minutes. It makes for a long meeting, but that's okay. Everyone needs to be heard. However, in an effort to keep things moving and have conduct our business for this evening and keep things efficient, I'm proposing also as part of my motion that we do not grant additional time. Everyone gets 5 minutes, and then we got to move on to the next speaker because we literally have 3 hours of speakers. So is that okay? Then I'm going to make a motion that I'm going to make this in a proper motion. We are going to suspend the portion of policy 903 this evening, just for February 16th, to allow all the speakers their due time of 5 minutes. When you do come and speak with us, if you would please state your name, address, and a group affiliation, if you're with a group this evening. And so at this time, we will move to recognition of visitors. Oh my gosh, I'm so sorry. We don't usually do it in that order. Thank you. Really appreciate it. I'm sorry, you guys. Linda seconded that. Is there any discussion? All in. Yes, that includes the 5 minute limitation that we all agree we're not going to extend tonight, but everyone gets the 5 minutes, and we're allowing to go beyond the 30 minutes that the policy normally constricts us by. Any other discussion? All in favor? Aye. Opposed? Same sign. Okay, and one no. I'm sorry, but everyone else was aye, correct? I'm sorry. Okay, thank you. Sorry, Luke, you just caught me on that one. So we're going to have recognition of visitors for matters related to the agenda. And if it's okay with the rest of the guests tonight, we go A through M. But we have a parent that has made us aware that they have a family commitment directly, and also they're constricted for time. And so if it would be okay, I'm going to I'd like to move Jamie Patullo up to seat A to speak with us first this evening. And that's critically necessary for her and her family. So if that would be okay with the rest of the speakers tonight, we would appreciate that. Mrs. Patullo, if you wanted to come up to the podium, name, I know we know it to a lot of our speakers tonight, name, address, and if you're with a group. There you go. You're good. All right, no problem. All right, that works. Okay.
My name is Jamie Patullo, and I live at 112 West Normal Street in Edinburgh.
I come here tonight to speak for my child and others like him with complex medical, social, emotional, and educational needs. I come here as a substitute teacher for the district in the IU5 and have been happy to help in any environment whenever available. I have masked 3, 4, and 5-year-olds with social, sensory, and communication issues who are experiencing the world away from their home for the first time. The option to stay home is necessary and one we've built into our lifestyle due to special needs, medical issues, lack of a support system, and of course, due to our current health and safety plan. I can't leave my child at home alone. My child can never be left alone. There is little to no at-home help for families like mine, even when times are great. Our life is isolated with or without COVID. We have no family support here. School has always been a huge support in our lives and one that was reliable. My husband and I have been long committed to public education and equal opportunity and moved to the state and school district to serve and be served. We love this community and our school district. Tonight, I want to ask that you continue to support a family like mine and choose option 3. My son received specialized instruction in the Barber Center self-contained room in the middle school for the entirety of the school day. We are extremely grateful our district houses this program. He shares this room with 4 other boys and the same staff every day. He is unable to participate in after-school recreational activities. He has been contact traced twice now and has missed many healthy days spent standing at the door, shoes and backpack on, watching for his beloved bus with driver and nurse who love him. He is within 6 feet of an adult for more than 15 minutes at a time for approximately 80% of the school day. He requires a one-on-one throughout his day due to several factors, including seizures, where he falls as he's standing. He has had many seizures at school and on the bus and is well cared for. He adores school and is loved. As a family, we have always done what's needed to support him in school, and school has always worked with us. I feel confident in sending my child who cannot speak out the door every morning. He has come so far with the right support. Going remote in 2020 was a total loss for him and for most kids like him, and many in regular education too. Other than throughout this pandemic, his attendance has been near perfect since he started school in the district at age 3. It is detrimental in so many ways for him to miss days and is a real loss in the grand scheme of his life. So much has been taken from him already. So much has been taken from all of our children. There are many families in our district just like mine. Every missed day is important, and that is for us to decide, not others. Every missed day is something that's been taken away from him that he can never get back. That is hard for a parent of a child with an already limited life and future. Virtual or remote learning is not best practice for a child with such specialized educational and behavioral needs, and his hardworking team agrees. It is not the least restrictive environment, but rather the most. A child like mine benefits greatly from seeing an adult's whole face, and I would like the excellent, educated, dedicated professionals caring for him to be able to make their own choice. It's time to let professionals do what they feel is best for themselves. If they can't be trusted to choose what's best for themselves regarding COVID, how can we as parents trust that they're doing what's best in regards to our children's education? If professionals choose to continue to mask, I will respect that. Due to his epilepsy, my son has never worn a mask. Seeing his face and cues are important, and that has been agreed upon by his team. Being autistic and having sensory issues are extra. My other 2 children, one of whom has autism, have worn masks dutifully and may continue to choose to do so. Forcing my child or any child to stay home when he is asymptomatic is wrong on so many deep levels. Quarantining healthy people is not an effective measure to offer others protection. It is feeling like segregation more and more each day. My child is medically vulnerable, and I'm asking you to let us all make best choices for ourselves. We have been doing what we've needed to do to protect ourselves far before COVID. Everyone should do what they can to protect themselves, but that must not infringe on my child's right to a free and public education. We are only in charge of ourselves. Voting for option 3 is the best way moving forward to continue with seamless instruction, maintaining behaviors and expectations, building back school morale and pride, inclusion, and supporting families. Time up. I ask you tonight to make the choice that allows us all to choose what's best for ourselves. Please vote option 3. Thanks so much for your time.
Jeremy, is this one's on, correct? Okay. You just have to get closer to the other end.
That's great. Very comfortable, as always. Okay, well, I'm going to go back and say that again, please, if you guys don't mind. I meant to say earlier, one thing that we had, I wanted to work out with the board is I wanted to give everyone a 30-second heads up that you had 30 seconds left as a courtesy in case you wanted to wrap things up, because at minute 5, we are moving on. So I just wanted, if you hear me interrupt you, that's what that's about. But you have 30 seconds after that. And thank you for your understanding. Mr. Paul Westcoat is here to talk about the health and safety plan. And then we're going to ask, as you know, name, address, group affiliation, and then your time will begin. Thank you.
My name is Paul Westcoat. I'm a parent. It's General McLane School District. That's my group
I
affiliation.
need your mailing address, please.
I'm not giving you that. If you check the packet in paperwork in your packet, it's against the law for you to ask for that, and I'm not giving it to you.
It's a policy of this board. And
It's
so
against the
I'm
law
sorry,
in
then,
Pennsylvania.
we can discuss it later.
I can do that too, lady. No. I'm
You know
not
what?
giving you.
This is it. Second, you need to leave. I'm sorry that you need to leave, please.
I'm telling you.
You have to be a resident. We get to verify that. That's the policy.
It's a lawsuit, my friend. Your oath of office is to breaking a law.
No,
I'm not breaking a law. No. It's a law
I don't
in the
even
state
know
of
what to do with this
Pennsylvania.
it's the address. I'm sorry. It is a policy. If we could have name and address and
It
group
breaks
affiliation.
the Constitution of the law of Pennsylvania.
Please, Mr. McDonald, you are a solicitor. Can you please help out this gentleman? It is a valid law. Can you please stand?
It's a valid law in the state of Pennsylvania.
The
You should be arrested.
case
because you're
the
breaking
case that was in the packet is one court at a lower trial court level on the facts of that case. So it is not controlling, and this school board has its own policy. And
Yeah, we'll see, buddy.
at this juncture, it's our recommendation that it be
We'll have this
respected.
discussion in court. I'll see you there, pal, along with the rest of you.
Mr. Alan Turner, Health and Safety Plan. Name, address, group affiliation, if any.
Good. Alan Turner, 8400 Pagan Road, Erie, PA. My group affiliation is the entire General McLane School District. That's who I'm for. I'd like to start off by telling you a little background story about myself and the experience I had at General McLane High School. In February of 1996, my older brother took his own life. What my family witnessed and endured immediately impacted my life immensely. The first and one of the hardest lessons I learned from this was not all teachers and administrators will do what's best for each individual student. My subsequent senior football season taught me that. When the principal and current affairs teacher decided to simply fail me for the class, deeming me ineligible to play rather than digging deeper into my personal situation. I had a B grade in the class, but I was told it was based on attendance. Some of you board members may know the principal and the teacher. That being said, I still love my school and what we stood for. It wasn't just the principals or some of the teachers that made General McLane such an amazing school district, although their egos may have thought differently. It was everyone and everything that made GM the great district it was. When I attended General McLane from 1993 to 1997, we were top in everything from academics, band to athletics. We had academic teams bringing home national trophies from Texas that were taller than me. Our band had over 200 members and also brought home top hardware quite often. Then our athletics.
Mr. Turner, your comments need to be directed about the health and safety.
I'm getting there. I'm leading up to my passion and what I feel and how much I feel about the
Thank
school
you.
district.
That's
I'm
great.
leading that. My
Thank
time
you.
should be duly
That's
noted
great.
there,
Thank
please.
you. Thank you.
My time will be noted there. When I tops 200 members, then our athletics were second to none, and that was every sport, not just football and basketball. on the girls' side as well. We were either at or near the top of every sport. So that brings me to today. I see an unwarranted arrogance by teachers, coaches, and administration. I saw from this very board in last November's meeting I attended an arrogance I never thought possible. I saw members rudely whispering to each other while people are talking to the board. I saw facial expressions that infuriated me just from a sheer arrogance standpoint. What are you guys so arrogant about? Is it the $3.5 million we're in
I'm
the
sorry,
hole?
that's inflammatory.
Is it $3.5 million we're in the hole? Or is it just about every department in our district is struggling? We haven't had many winners lately. Is it masking kids only at school?
I'm sorry, are we getting to the health and safety plan? That is the last warning.
I've watched this district slowly deteriorate over these last 20 plus years and watch this district. And I'm going to be honest, it sickens and saddens me that this is what we've become. I'm not going to sit here and tell you this stat or that stat as I know you all know what is going on, and yet you still have the lack of the next word I'm going to use, and that's common sense. Common sense should tell you how we are doing things isn't working. Masks do not work. Quarantining healthy children do not work. And testing healthy children with false tests didn't work either. I see a hypocrisy second to none. I see parents, grandparents, brothers, sisters, aunts, uncles, cousins, friends, basically most everyone, including many teachers and board members, walk around everywhere, stores, sports fields, picnics, and gatherings with absolutely no mask or social distancing since day one. Some of you I've had personal interactions with. Yet teachers and administrators are singling out and bullying children who don't want to wear masks or aren't vaccinated by upholding these nonsense rules. One of our very own longtime teachers risked death for this reason, death. So I challenge you all to start using common sense. It's completely mind-boggling to me to see the people come into our once great district and all they want to do is change everything we've done to make it such a great community and district. I encourage each and every one of you to take a drastic look at what's going on here. I also want to thank you for waking up this sleeping giant and opening our eyes to what's going on in my beloved district. My sons are third generation GM students, so you see not many are as passionate and bleed red and white as I do. And I'm going to continue to closely monitor what's going on and being said, along with many others who want to know the truth as to how we got this bad. Once again, common sense should show us where our problems are. So I encourage you all starting at this point forward to do the right thing, because it is not, there's a large number of us, just as I've heard being said, the loud minority. We are the loud majority, and we will be calling out your indiscretions, and we will be coming after your seats. Thank you for your time.
Thank you. This is Ms. Rachel Arkwright.
Can't hear you, sir.
It's on now.
I'm asking for clarification on how we will handle the additional speakers. I'm just concerned that we're trying to apply policy very quickly to certain statements, and I think it would be easier if we just allowed them to speak unless they made some sort of extreme statement.
Well, I preside and I disagree, and so we're going to leave it that way.
I'm
Ms.
sorry,
Rachel
Carrie.
Arkwright.
I'm sorry, Carrie, I couldn't hear your response.
I said we're going to follow policy 903 and get through this evening. And so it is what it is. We have rules, we have to follow them. We don't just allow things. And because if we allow it now, we don't allow it another time. We know what it means to be appropriate. Okay, Rachel Arkwright.
Rachel Arkwright, Region 1. If you want my address, I will write it down and send it to you. It does not need to be recorded in your minutes to be posted.
It actually does. That's sort of the problem because it's public participation and people are interested in transparency.
I think it's hilarious that our board can't just automatically know which one of us are GM graduates, GM taxpayers, GM parents with kids enrolled in the building.
It is a policy that we don't waiver from just because people don't like it at this time.
2727 Dunn Valley Road. Do you need it spelled? D-U-N-N. B-A-L-L-U-I.
Thank you.
Thank you for allowing me the privilege to address this board today. I do absolutely expect your undivided attention. Please, no side chat. The board has made horrible decisions in the regards of religious exceptions. You've broken civil rights and several laws. And yes, I know the board believes that they were doing what they had to and they were following the recommendations, but you were led by fools who only made recommendations. They were not laws, they were not mandates, they were recommendations. The CDC cannot make any laws. They make recommendations. They don't even make policies. Just because you followed those recommendations, do not think for 1 second that those recommendations will protect you in a court of law. The policy that this board crafted to not accept the religious exemptions to the mask mandate is in direct violation. Denying constitutional rights because you followed recommendations, it's simply not acceptable. The PA Department of Health lost their legal case to enforce masking. Erie Department of Health only ever made the recommendation and referred parents back to their school districts and their school boards for religious exemptions, who then sent us right back to the Erie Department of Health, trapping parents in an endless rat race with no answers. You frustrated the parents chasing a direct answer, a way to help their child, to help a GM student. You denied the civil rights. You denied religion. And then in what has encompassed the US, we have now adopted this fake, for albeit religious symbol of these masks. We're enforcing this political religious symbol on everyone and making them deny their own religious rights because we don't accept them here in GM any longer. From August until February, we're in February, we've played this game. With the constitutional rights be damned. This is completely sickening. For every board member, you should be embarrassed for enforcing this. You should be embarrassed for continuing it. What has been gained by enforcing the denial of a constitutional right? We've taught our students that they are worth less than their teachers and then the staff. We've allowed staff, teachers, and even you precious board members have engaged in a form of bullying and saying nothing to stop it. We have forced others to deny their beliefs to accept ours. A mask should never have come to this. The whole line of, oh, there's only a few that have said something, or the kids don't say anything. Why would you ever believe these students would say anything when for the last 2 years, it has been proven that their statements fall on deaf ears at this board? Their opinion is worth nothing. Their requests are denied or not heard. Why would you think the students would say anything? And why do you think that most of the parents have been standing by GM and our board and our schools? Because we never thought we would watch you continue this charade. None of us, any GM alumni in here, we're all stunned that you would blatantly disregard religious exemptions. Not mask everybody, mask no one. That's not anybody. Somebody said choice. Cool. Choice should be great. But denying a religious exemption, not even allowing the possibility. Unacceptable. Would you accept that of our students? I certainly hope you wouldn't accept it of your staff members. The board has so decreed, so let it be. The teachers say, oh, well, it's board policy. I just have to follow it. The administrators, well, the board said. Even our superintendents can hide behind, the board said. And when one of us reaches out to you, oh, well, I can't speak for the board. You have to bring that up to the whole board. It's almost like the board is the Wizard of Oz. Nobody can find them. Guys, you have the power to fix that one right today. Accept religious exemptions. We have students that can't attend GM because of this inflexible policy denying their rights.
Just a clarification.
Do it today.
You get 30
I
seconds.
got it, Luke.
Okay.
Thank you.
I did ask you not to do that at the beginning.
Yeah,
No,
I was trying to.
she's been doing it the whole time.
Kathleen Higgins, Health and Safety Plan. Thank you. Name, address, and group affiliation.
Kathleen Higgins. I live in Waterford, Pennsylvania.
I'm sorry, we need street addresses. I'm not making this difficult. This is a
Excuse me, I didn't
policy.
finish talking. You interrupted me. I was about to open my mouth. I live at 12770 Hill Road, Waterford, Pennsylvania, Erie, PA, United States of America, the last time I checked. So I had a huge list of things that I was going to say today, and I threw it away. I drove to New York and back. I had a meeting, and it was a pretty awesome list. It was all the things that were said at the board, and I didn't say anything about who it was or anything. And then I just said to myself, I'm going to be better than that. I am not going to go there. I'm going to ask, it's pretty obvious you're probably going to do mask optional, which is common sense. And I think we've all gotten there. And at this point, I'm going to ask you to do away with any contact tracing, anything other stipulations. And with regard to the health and safety plan, why is it that I asked for it last Thursday and I didn't get it until yesterday when I have to ask it for again? So with regard to transparency, Ms. Crow, I'm really looking for all the information that is found online, such as the American Rescue Plan and how ESSER funds are going to be spent that we stumbled across in our group, the GM Parents United Coalition. That's my group affiliation of 425 parents and local community members, which represents 1/3 of the General McLane parents. That's pretty impressive. And there's also about 1,800 members of parents and community members like-minded that are also part of an Erie County Parents representing, Erie County Parents Protecting Children, excuse me. And so I strayed away from the list to say, when you're creating the next plan, think about how much time you've wasted on masking children for money. Can you look yourself in the mirrors every night? Can you look yourself in the community members' eyes and say, I did the right thing for education for these students. I bettered Edinburgh. I bettered the community of which General McLane serves. I upheld my oath of office by supporting an illegal mask mandate. It was void ab initio December 10th, 2021. December 11th, masks should have went away. So when you decide to vote for option 3, hopefully tonight, I hope tomorrow these kids walk in without masks. Why? Because it's already been void ab initio. So do the right thing. I could ask you to circle back, but I was told that I'm not allowed to say circle back like a redheaded stepchild. Or
Yes, you're not.
no?
We're not going to have vulgar language here. So
What do you mean? How is that
continue.
vulgar language?
Inappropriate.
It's inappropriate and it's.
How is it inappropriate for who?
Oh, okay.
What are you talking about?
We expect our language and sentiments to be appropriate for a
What
public school board
word
meeting.
was vulgar? I'm sorry.
Okay, I don't know.
Can you spell it so we're not saying it?
It's okay. You're fine. Just
Thank
please
you.
refrain
I know
from
I'm
going
fine.
to the vulgarity. Okay, thank you.
Vulgarity. Who swore? Nobody swore. I can swear like a trucker if you want to. I'm pretty good with the F-bomb.
Let's be productive. We have an efficient meeting
Right.
tonight.
So don't banter back and forth and waste my time. Anything else? You good? Can I have my time? I'm waiting for an affirmation. I look for a facial expression, but your mask is on. Oh, that's a nod? Okay, thank you. So basically, I was really trying to stay positive and go back to the great things that brought me to this community. I went to school here at Edinburgh University, and then I left, came back, went around the world, and I came back, and I decided to settle in GM because it's a great school, and it still has a lot of potential. And why does it have potential? Because these parents here that show up, the 425 plus parents in our group that want you as board members to do the right thing and uphold your oath of office. Don't take government money. Don't become a government school, become a public education. Represent the people of this community, not the government. You know, for the people, by the people, voted in by the people. And we can take you out as well.
Okay, we're at 30 seconds, so you have 30
thank you.
seconds. Go ahead.
So on a positive note, you know, there have been 0 deaths in the state of Pennsylvania as a result of from COVID. There have been 0 deaths in Erie County directly related to COVID, not a drug overdose. And there have been, so our death rate is 0.0%. And that's pretty good reason to take kids out of masks. Take the face diapers off. Thank you.
Thank you. Ms. Rochelle Shaw, Health and Safety Plan.
Good evening. Can you hear me okay? Can you hear me now? Can you hear me now?
There you go. Yes.
So my name is Rochelle Shaw. My address is 5510 Ponderosa Drive in Edinburgh. I hold a bachelor's and a master's degree in education, having been a teacher in a middle school, high school for 9 years. And I currently hold a bachelor's of science in nursing with a med-surg board certification. For the past 8 years, I've worked as a nurse. I'm here to talk about why, from a public health perspective, now is not quite the time to transition to optional masking in schools. So if in-person instruction is the goal for our students, eliminating universal masking now would prematurely remove a mitigation layer against COVID-19. To say that cloth masks don't really work goes against the evidence. Not masking is the only scenario that doesn't provide any protection whatsoever. In fact, the CDC just published a study on February 11th that showed yet again that people who masked indoors were less likely to test positive for COVID-19 than people who didn't wear masks. 56% less likely for cloth masks, 66% less likely for surgical masks, and 86% less likely for the type that I have on, which is a KN95 or N95 masks. I fully support removing masks when the time is right, but that's not now. The cases within our community are still high. Hospitals are still busy taking care of COVID patients. The ICUs have some of the highest numbers I've seen, and access to supplies, resources, and staffing numbers are not getting any better. If anything, they're getting worse, and this is what I experience every day at work. On the surface, to you, the general public, it may look like things are improving as the reported numbers of cases had decreased in the past week or two. The keyword here is reported. People who test at home aren't required to report the results, and there are people that simply just don't get tested. There were a record number of 12,507 people who tested positive in Erie County last month, 12,507. There may be fewer people in the hospital, but that might be because there were 48 people who died in January, 72 in December, and 67 in November. February is only halfway over, and there are already 31 deaths this month as of Monday. A total of 749 people have died from COVID in Erie County, and 25% of them were in the past 3 months. So I don't understand how that's an improvement. How many of these people were our community members and the family members of our students? Perhaps that's contributing to the increase in student assistance program referrals that the school is seeing. To really understand the spread of COVID-19, we can look at the wastewater reports for Erie County. There was a new one that actually just came out yesterday. It said that the virus levels are increasing and that this wave may worsen before it goes away. So if people aren't getting tested or they're not reporting their tests, what we flush down our toilets doesn't lie. And it's saying that we still have very high community spread. That's a problem because we can't rely on the warmer weather to assist with any mitigation efforts should masks become optional. Vaccines aren't available to all ages. We have preschool programs in our elementary schools. You also can't rely on the test to stay program any longer if students don't wear masks. If you look at how it works, you test students on days 1 to 4, then again on days 5 to 7. The days can't be back to back, and the students have to be masked and they have to social distance. It takes a while for the antigens of COVID to show up in the body to the point where they're detectable on the type of test that the school would be using. So let's say a student's positive for COVID. They may not test positive until the 5th day or later. If masks are optional and this student doesn't mask, they will have gone up to 5 days in school, at home, and elsewhere, exposing who knows how many people. So if you read the Department of Health's webpage, it states that this program would be useless if students aren't masked. When we need something fixed, we go to the professionals specifically trained to do the work. You see a contractor to remodel your house, an IT specialist to fix your computer, a counselor for therapy. The advice and guidance we follow regarding COVID-19 should continue to come from healthcare professionals well-versed in public health, not from people who have become Facebook epidemiologists over the past year because they think they know how to do proper research.
Rochelle, excuse me, you're at 30 seconds.
There's a reason the CDC and American Academy of Pediatrics still recommend universal masking. I would urge you to uphold the safety plan that you approved on January 19th. That said, I do think you should reassess our situation from time to time to determine if masking should be optional or mandated based on the circumstances. I'd like to see you wait until April, honestly, to see if things are really improving. Growing up, we're taught the difference between right and wrong. Our children are relying on you to make the right decision for them. Don't cave to the pressure from others who have no background in public health. Our community, our healthcare workers like myself,
Rochelle, we're
and
right
parents
there.
like myself are relying on you. Thank you for your
Right there.
time.
Thank you for your time. Thank you very much. Dr. Maggie Bible, Health and Safety Plan.
Hi there, good evening. Can you hear me okay? All right. My name's Maggie Bible. I live at 3050 McLaughlin Road, Waterford, and that's Washington Township there with it. I just wanted to speak on behalf of my family and my children who are students here, as well as my experience as a physician working within our community. I was able to share some links to the current recommendations that are given by the American Academy of Pediatrics, the Centers for Disease Control, World Health Organization, the Department of Health for the state of Pennsylvania, and the Pennsylvania Department of Education, which currently for the 2021 to 2022 school year are encouraging universal masking, and they're recommending those on behalf of all of those organizations. I think one of the difficult things with the way that we've had to make changes over the past several years is that we are always getting new information, and it can be difficult sometimes to interpret and difficult for people to have an understanding of the overall impact and the ripple effect that even just one positive case can have. The idea of kind of changing horses midstream, if you will, for the term at this point in time regarding the policy would, I think, be very difficult and really have a lot of negative effect for the families and for the students throughout the rest of this school year. As we've said before, the idea that the departments that have given these recommendations are for public health and public education. What we're trying to do in a standpoint of a public health is that, yes, we all have individual rights, but we all have individual responsibilities as well. And until we can see things that have such an impact where our numbers are going down to such a point that it's much less of a risk, it's really difficult to support anything from a standpoint of anything besides universal masking at this point in time with it. Yes, we are getting more vaccinations, out to everybody, but that is also not something that is, required just yet, but is something that's encouraged. There might be talk in the future for dropping masking from other organizations, all that kind of stuff. But until you can get those rates up for the children, and right now I want to say it's like for the for the elementary school population, it's only like 18% is fully vaccinated. And this is talking, nationwide there with it, and maybe only like half or so for the older population of kids there with it. It's just not providing the same amount of protection that you would see with the adults from the community standpoint with vaccinations there with it. The other thing that I want to kind of think about from the standpoint is that, the idea that you have people that have dedicated their lives to public health and public safety and epidemiology and taking care of, sick patients and trying to educate your patients regarding what their best decisions should be there with it. And when people are kind of throwing it back in their face and saying, well, I don't like that. Well, there's lots of things that we don't like. I don't like having to, drive my speed limit. I don't like having to stop the stop sign. But those are things that are going to help to keep other people, including myself, safe there with it. If the elementary school wanted to have an addition built onto the school, you would be getting recommendations from architects. You'd be getting designs planned by electrical engineers and plumbing and waterworks and all these kind of recommendations. And the idea that safety plans within a building that was being built and the water sprinklers for a fire, emergency exits, that kind of thing can be kind of voted on and kind of, shot down from those experts that are trying to keep as many people safe as possible. It sounds preposterous when you propose it like that. I think it's also something to consider. And, there's always going to be talk about, though there's less impact overall for the younger population, but really and truly, we don't know what the long-term effects are going to be for COVID infections for children. And I think from the standpoint of the board and from the school district, that's also something that you need to consider from a legality standpoint. If a child is exposed,
Dr. Bible, I'm just going to interrupt you. You have 30 seconds.
No problem. Thank you. If a child is exposed in a situation and there was an option for the board to make choices to help keep them as safe as possible with the current recommendations that are given by the Department of Health, Department of Education, CDC, World Health Organization, and the American Academy of Pediatrics, if the board chose to vote against that there with it and possibly expose them, what are the long-term kind of legal effects there with it? That could be if a child is sick for an extended period of time. Thank you guys for your time. I appreciate it. Thank you.
Thank you, Dr. Bible. Mr. Randy Jeffrey, Health and Safety Plan.
Randy Jeffrey, 8712 Mayfair Drive in McCain. I am the proud parent of two kids at McCain Elementary. And obviously, we all have a lot of emotions about what's going on in this pandemic right now. And I'd say for the most part, I think all of us want this to be over. We all hate what's going on. We all are tired of this. But at the same token, I think it's very important to try to take emotion and a lot of the desire just to get back to normal out of the equation and use a lot of the data and the research that we've obtained over the last couple of years to try to help guide us in terms of how we should be really reacting in a situation like this. The fact is, masks really do work. And I have to say that the decision by this board, unpopular as it may be with some, has really kind of helped shape how this year has gone. And it's kept this school board open. It's kept people in the seats, students, families working because their kids aren't going home with COVID. And the fact is, we have a lot of examples from around the country, Arizona, Maricopa County, North Carolina, even locally, at the effects of being a little bit premature with removing masks from the equation. And I think it's very important that we kind of follow the guidelines that we've already set up to try to help guide us when it would be safe to actually remove those masks on behalf of our children. So at least from my standpoint, I do have some personal experience. I'm a physician. I see patients regularly in the hospital, in the clinic, and some of these patients have COVID. Some of these patients, we find out 4 or 5 days later, were COVID positive, but we didn't know it at the time. Myself, colleagues, other staff see these patients on a regular basis, yet we're not all coming down with COVID. There has to be something to that. And I can tell you what it is masks, as not every person that I work with all the time is vaccinated, yet still somehow they're avoiding infection. So I can tell you masks do work. They are effective. And I know there may be a lot of opinions about what effects may have on education. There's data out there. Which way you want to read, I guess, is important. But what I can tell you is that the biggest effect on education and the biggest detriment to a child's education has been by far and demonstrated and written about is the fact that kids aren't in schools, school closures, kids being quarantined because they have COVID, having to actually deal with distance learning. All of these things have been actually demonstrated to actually affect school performance. Not wearing masks. And I think that's one of the biggest differences that we need to point out in a situation like this. So obviously, we already have a policy that's in place. I think that policy is very effective. I think using the data we already have and the guidance that we've already been provided by agencies that have experts that deal with this type of problem is something that we really should be abiding by. Ultimately, I'm hoping over the next few weeks, with any luck, maybe optional masking is a thing that we can do already. So in this instance, I would just implore you to really vote on nothing. Just continue doing what you're already doing and follow the policy we already have in place. Thank you.
Thank you, Mr. Jeffrey. Olga Kuffer, Health and Safety Plan.
Hello, how's everybody doing? I know it could get grim at the times, but anyway, my name is Olga Kiefer and I reside at 6741 Route 6N in Edinburgh, part of Washington Township. Again, I still continue to thank the board for everything that they do, and I know we have come a long way from our very first meetings in August to this meeting. I do want to thank you for the hard work that you do, and I know you do it. And even though we have a major difference of opinion, I still want to recognize the board for all the work. However, I still want to remind you that we are still facing a lot of challenges, and amongst those challenges, I want you to remember that you are still representing our children. And you are educators. This is your primary goal. So we are in the business of educating children, not but advocating for health policy. I want to refer to the previous speaker and also mention that it was mentioned that it should be an individual responsibility. So I think at this point, it should indeed be an individual responsibility that everybody would be looking out for their health. It is not the the task of a school board, not of your school principal, not of a superintendent to tell you whether you should mask or not. It is a common sense. If a child is sick, we stay home. We continue on with maybe some non-conventional treatment. Again, I'm a born-again Christian. I will not take any kind of a pharmakeia. I'm not advocating certainly for that. But in the meantime, I also wanted to mention another speaker who mentioned something about immunity. We also should understand that natural immunity lasts a lifetime. There are millions of studies out there on the natural immunity, and our skin microbiome has its own properties that, like B and T cell immunity, that stay in our bodies for a lifetime. So we should probably listen to what the science says and not to what the politicians say. So anyway, the other reason, of course, why I'm here is because of the lack of a religious exemption. In your discussion last week, and obviously I would like to restart this initiative. I think one of our speakers did mention it very rightly that the board, and in particular our solicitor, has to restart this kind of conversation because, again, we have people of different faith here. And this is the part of the reason why my children are out of this out of the school. So I would really implore you to restart this conversation on the religious exemption. Again, I have strongly held beliefs that, again, we do not follow, I don't know how else to tell you that masks, vaccines, vaccines, PCR tests, which are pretty much useless. CDC said so too. They are part of the BEAST agenda. And I already stated my sincerely held belief that we will not be part of this BEAST agenda. So we really strongly encourage you to consider people of faith like us. We are the voice. We have the voice too. We want to be recognized. Mr. McDonald, I know I'm not supposed to call you by name, but I really implore you to really just, this is our right. No health department can take our rights away. No school board can take our right away. No member, no teacher. It is my sincerely held belief. Would you please listen to us? Would you look into these laws? Please, I'm asking you, I'm begging you. My children have suffered greatly. Yes, I had to put them through cyber school and they're not doing so hot because mom also has to work. Mom has to juggle a lot of different things. So again, here we are, learning loss, lockdowns. I think all these things have really played major part in failure of our children. So again, I know I have strayed away from my original text like I always do.
Olga, you're
Yes.
just at that 30-second mark, but please proceed.
Thank you.
Sorry.
But again, I'm just asking you that instead of tying your own hands, you will instead of tying your own hands and neglecting your role as educators, promulgating learning loss and failing our students who already have been traumatized by last year lockdowns and major learning loss stemming from your current policies, I'd like you to vote for this current vote
Olga. Thank you,
that would
Olga.
free children from oxygen abuse. Thank you.
Thank you, Olga. Ms. Pam McCallsick, thank you, regarding the health and safety plan.
Pamela McCulsick, 201 Fairway Drive. Everybody hear me?
Yes.
I'm a parent. Thank you so much for your work in keeping our district safe and our kids in school and for allowing me the opportunity to speak. Like you said, my name is Pamela McCulsick. I'm a proud graduate of GM. My parents, John and Marilyn Merzlock, both served the district for many years. They were the driving force behind the marching band. I currently have 3 children who are attending school and a 2-year-old at home. Professionally, I'm a forensic DNA analyst who currently performs scientific audits of crime laboratories located all over the world on behalf of ANAB. My job is to ensure that scientifically acceptable practices are being executed for the testing and reporting of forensic casework per international standards. I know that everyone is aware that Dr. Lane's current recommendation to the board is to make masking optional in the district by February 28th. I'd like to provide some additional thoughts to consider to some of the reasons behind his decision and that he so kindly shared with me. One reason he shared is that there's been a dramatic decrease in case counts and hospitalizations, both in buildings and across the district that mirrors regional trends. However, the Erie County Department of Health's COVID-19 wastewater level report that was mentioned earlier, published yesterday, states that wastewater virus levels have been slowly increasing over the past 2 weeks after rapid decline, indicating that COVID is continuing to spread in the county at high levels and suggests that this wave may worsen a bit before it goes away. Viral levels of wastewater are more accurate than reported cases due to the fact that at-home testing is more widely available and it isn't publicly reported. Additionally, 25% of the COVID deaths that have occurred in Erie County have been in the last 3 months. Well, it's not students that are dying, it's their families. I know, and I'm sure you do too, multiple people in our community whose lives have been changed forever by this virus. The other reason that was given is that vaccination is available to nearly everyone age 5 and up, which is the population for whom the board's responsible. The actual percentage of vaccinated students in the district is very low, and the availability of the vaccine means nothing if the population is nowhere near herd immunity. It is also my understanding that there isn't a clear record of students who have had COVID, which of course would inform the level of immunity as well. Perhaps an effort could be made to compile the data to determine the actual level of the district's herd immunity. And if it's a reasonably high percentage, that would be a data-driven indicator that optional masking will not significantly affect community transmission. Secondly, I feel that the district does have some responsibility for the potential to affect transmission to kids under 5 in the community, particularly when both of the elementary school facilities house children every day who are in that age group. It also doesn't fit with GM's core values that state that we value a sense of community within the district and with the community at large, and that we value long-term commitment from employees, graduates, and residents. How is ignoring the fact that making masking optional has the potential to increase community spread, not discounting the district's retired employees and older alums who are at much more of a risk from Omicron and its subvariants? How is it not discounting teachers and staff with families that include children under 5? You also mentioned that we have this test to stay program in place, but it will only be effective if students are actually enrolled in that program. From what I understand, hardly are any enrolled at all. And so it's not accurate to present it as a mitigation measure when it has gained no traction. Dr. Lane and I are in full agreement that masks did not cause the current mental health crisis. His assessment that students' time at home in early 2020 and other periods of quarantining is the source of the issue, but this makes the mask optional recommendation all the more perplexing. Data shows that masking has and will continue to keep children in school, which again is the primary objective. I also think it is reasonable to say that students losing loved ones to this virus has had a greater negative impact than masking has, which is something that should not be forgotten. I'm not advocating that we should never be mask optional, but because the decision is not currently data driven due to false metrics, now is not the time. It would be more prudent to wait until the county wastewater COVID levels indicate low transmission. Additionally, it will allow more time for recruiting families to participate in the Test to Stay program. We'll be closer to having a vaccine for children under 5, and we'll be closer to nicer weather, which will allow for additional mitigation. I also want to speak on the value that we place on the opinions of individuals who are experts. You heard and still have yet to hear from individuals who reside in our community. There are medical professionals that included board certified physicians. I also know that Dr. Cynthia Lagan-Bussell, who is a board certified psychologist that specialized in children's mental health, submitted a letter to the board. Not only are they all in agreement that now is not the time for optional masking, but their opinions are in line with the current recommendations from the experts at the CDC and the American Academy of Pediatrics, something that should not be considered lightly.
Ms. McCulloch, we're right there, 30 seconds. Thank you.
I do want to, lastly, while I do want the board to make a data-driven decision regarding optional masking that is based on reliable data, I also want to make a plea on behalf of the medical professionals in my life that are begging us to help stop the spread of COVID in the community. And it seems like no one is listening. One of my best friends that I met on my first day at Jack and Jill Preschool is a physician, is an out-of-state physician, and she's completely burned out. She's put a lot of things in her life on hold so she can help.
And we're right there. I'm very sorry to cut you off. I apologize. I apologize. Thank you. Thank you very much. I'm sorry, Michelle Repman Pfeiffer, Health and Safety Plan.
Hopefully my time will start after I give my address. Michelle Repman, 11597 Lay Road, Edinburgh. And I own 4 properties in the district. So I'm not only a parent, but I'm a stakeholder, more than most. Okay, the power under the Constitution will always be in the people. It is entrusted for certain defined purposes and for a certain limited period to representatives of their own choosing. And whenever it is executed contrary to their interests or not agreeable to their wishes, their servants can and undoubtedly will be recalled. That was given by one of our founding fathers and first President of the United States, George Washington. So, we heard from medical experts here today. Well, I want to give you a little bit about my background. I'm actually a licensed counselor. Many of you might not know that. I work with people with disabilities on a regular basis, and I own a medical case management company, vocational rehab, and I do medical legal consulting. So I would say that though I don't treat people, I do treat them in a different way. And the mental health of these children is astronomical. Kids going in crisis. The PCR tests, I'll talk about that. It's cycled at 40 cycles. Did anybody know that? And if you knew and did your research, it can pick up the flu, cold, and COVID. Because amazingly, nobody had the flu in 2021. There was only like 1,600 cases. So I think you have to look at all the facts. As I mentioned before, the virus cannot be isolated. It can't be isolated. So putting a mask on a child for something that can't be isolated, what is the background on that? I mean, I gave you studies last year published on the CDC website that says the PCR tests don't work, and also that the virus cannot be isolated. And what we're about is parental choice. If the kids want to wear a mask, wear a mask. If the parent wants to mask their kid, mask their kid. And if they're not happy with that, put them in cyber school, like everybody else you told us to do. Okay? The long-term negative mental health of these kids, I think, is much more important than a virus with a 99.98% survival rate, 0% deaths, 0%. I gave you all a handout that said about the masks. Right now, this week, General McLane High School had one case, one case. And in that case, it's a 0.14%. 1%, boy. So 99.9% of the people are actually healthy. So I'm actually asking you to do option 3. But besides that, I want to talk about N95s because that's something you were proposing. If you know anything about N95s, and I'm assuming these wonderful doctors here know, you have to be fitted for an N95. So I hope you will fit the children. And you can't touch your face. Don't touch your face because once you touch your face, you break the seal. And then N95 doesn't work. So, and I don't see, maybe there is one person on the stage. I see 3 with N95s. I don't know if that's one or not, but most of you have cloth masks on. So you get where I'm coming from. Also, I'd like to point out that there's 26 letters in the alphabet, and there's 25 facial expressions that cannot be seen for communication purposes due to masks. I have a child with special needs too, just like Jamie, who was our first speaker. And it's disgusting that you're making these kids wear masks so they can't communicate. You don't understand what we go through and the stress and the mental stress of it. I have a little picture if you want to see all the different expressions they cannot read. Sad, happy, puzzled, smart, excited, exhausted, frightened. You cannot see any of those expressions with a mask on their face. Not to mention the 11 different pathogens that are on these masks that can cause much more harm than a COVID disease that has a 99.998 survival rate. It's time to make it parental choice and go from there. The other thing I wanted to talk about was the field trip. And that was the New York City. I think you guys were voting on that tonight. It's on the agenda for the choir. I have a little bit of a problem with that. And the problem is the teacher that's taking them.
Michelle, just 30 seconds.
Thank you. Had ridiculed students for not being vaccinated publicly on Schoology and to parents. You're taking to New York City where there's a vaccine mandate. And guess what? Some parents may not want to vaccinate their children right now because they have a 100% survival rate and are relying on a natural immunity. So you're discriminating against students who may want to go on a field trip but cannot go because of the destination being picked. Very, very sad. I never thought I would see that, and I never thought I'd see a teacher discriminate against somebody who decides not to get vaccinated and yells at the kids for their masks. Very sad. Thank you.
Thank you, Michelle. Chase Swain. Regarding the health and safety plan. Oh.
Next to it again.
Yeah. Okay. There are two speakers, so are you guys, we can just stop if they want to. Yeah, okay. Okay. I mean, just let it roll. Okay.
Can you hear me? My name is Chase Swain. I live at 4941 East Avenue, McCain, PA. And I go to James W. Parker Middle School. Last week, my dad's school, Fort LaBeouf, got to go mask optional. And I got so excited and I asked myself why we had to wear masks. Because I can go to my basketball games and practices and I could take it off my mask, and so did everyone else. And I ask why we still have to wear quarantine for the close contact if we're still wearing masks throughout the day. Please vote to end masks tonight for me, my friends, the teachers, and staff. It should be a personal choice, not that one that is told to us. Thank you.
Chase did a really good job. That was good. Get up in public speaking. That's really good. Logan Ratkey.
Hi, my name is Logan Radke. I'm in 5th grade at James W. Parker Middle School. My address is 10070 Auberry Road. I do not think we should be told we have to wear masks. I wrestle, play football, and baseball. For the past 2 years, I have not had to wear masks during my matches and games. I do not understand why I have to wear this thing all day long when I'm trying to learn. Please stop making us wear masks.
Thank you, Logan. Really good job. You did a really good job for public speaking. That was really good. Thank you. That is it for our recognition of visitors for matters related to the agenda. We will have an additional session for matters not on the agenda later at the end of the regular meeting. Move on to communication. Sarah. Yep.
There are 13 communications in the inside of your folders. I'm not going to read all 13 of them, so I just gave them for you to review at your convenience. Jim. Yep.
One moment.
Sorry, I'm just checking to see if I can put them online.
Yeah, we're going to look into the nature of the correspondence. Some of them might be sensitive to names, et cetera, and content. So that hasn't been asked. So let us look into that. We appreciate your patience on that. So then we will move forward for consideration of the minutes of the regular monthly study session that occurred on January the 12th, as well as consideration of the minutes of the regular monthly meeting that occurred on January the 19th. Those have been posted. Did anyone take a look at them? Need any changes, addendums, or modifications to the minutes before they come permanent record? If not, is there a motion to approve? Any other discussion? All in favor to approve the minutes of the meetings? Aye. Opposed? Same sign. Thank you. Moving on to the superintendent's report. Dr. Lane.
It's okay. Thank you, Mrs. Crow. I just wanted to provide some 3 quick points here. There were some modifications to the original plans for this evening's part of the meeting, what had been the superintendent's report. If you remember, we were going to have Mrs. Iaquinta and Mr. Lucas present here this evening regarding the community-based instruction program that's at the high school. And I still want the board and the community to hear, of course, about what's going on in that program. But given the large number of speakers this evening and the time that it was going to take, I've asked Amy and Zach to join us next month. So we will definitely hear from them because that's a fantastic program. And maybe we'll have more time for that. Then also next month, we'll be hearing from Dr. Carnes as he presents on areas of curricular focus and identify needs across each of the 3 grade bands in the district. So he'll be spending some time to talk about what's coming next and what areas are going to have a lot of attention and focus from us across the 3 grade bands in the district. Finally, just regarding the health and safety plan. You heard from me last week regarding the rationale that I provided regarding why the pandemic coordinator and I made the recommendation that we made. And I don't need to restate everything and go through it twice. Again, I'm not going to do that. I do want to share, however, something that's a little bit more anecdotal that just provides some context for the discussion tonight. Recently, I had a conversation with epidemiologist Becky Dawson. You've probably seen her on the news for interviews. She was on Kathy Dahlkamper's press conferences, and things like that. So you've seen her, and she's not unfamiliar to us, I don't think. And we talked a lot about where we are now. We talked a lot about what's going on now, where we are now compared to where we are in the fall. And the phrase that we talked a lot about was, what does the science tell us? That was something we heard a lot probably from ourselves, more than we anticipated. But as it did in the beginning, for an epidemiologist like her, she's adamant about following the science. And that was something that kind of drove, if you remember when we talked in July and August, it drove a lot of the decisions and recommendations that I was making at that time regarding our health and safety plan, that idea of following the science. And what we talked about was that following the science now means a lot of things that it didn't mean in the fall. Following the science now means that we should encourage vaccines because they are safe and they work. Following the science now means that we should keep healthy kids in school. And just as we do with the flu, make sure kids that aren't well are at home. And what it means now is that we should live our lives like we have the resources available to us now that were not available to us in the fall, with an understanding of this context and this variant that's markedly different than where we were before. And that's what following the science means now. So because of that, it was my recommendation and that of the pandemic coordinator that we're in a position now to consider the plan that's before you tonight, because it's a plan that affords options when appropriate without sacrificing safety, because the situation and the resources available to us now are not what the situation and resources were in the fall. So with the continued recommendation, of course, that we can revisit the health and safety plan as needed in the upcoming months and not wait 6 months to do so. So I want to thank the board for considering this option from the pandemic coordinator and me, and I'd like to thank the community for their feedback tonight and throughout that process.
So we're going to move on to financial reports. Review, consider financial reports, accounts payable, cafeteria accounts payables as of February 2022. And accounts, and accounts paid and cafeteria accounts paid prior to the board meeting in January 2022. Mr. Fenda, take it away.
Thank you, Mrs. Crow. I'm going to share my screen so that everybody can see the reports that I'm talking about. So there you see what we call the treasurer summary report. It shows cash balances and investments at the end of January. For the general fund, $17.8 million. Capital projects, $7.5 million. Cafeteria, about $65,000. And student activities, $116,000. This is a graphical representation of the same information. Our fund balance has dropped down slightly between December and January. That's primarily because The revenues were down because the state subsidies come in every other month, and it so happened in January we were not receiving any state funding. Here are the revenue comparisons. In the middle, we have $20.9 million of revenues year to date. That's about 256,000 less than last year. And there's about $13.4 million in revenues remaining in the budget. On the expense side, we have about $18.9 million of expenses year to date. That's about 1.7 more than last year. And it leaves about 19.3 million in the budget for this year. This is a list of payments since the last board meeting, about $692,000. And additionally, we will have checks amounting to about $353,000 that will be sent out tomorrow. Here you see the Capital Reserve Treasurer's Report. The only activity here, and it's good activity, we received a payment for the used iPads that we sold of almost $9,000. We had planned for about $183,000. So we realized about $25,000 than we had planned for. Cafeteria report. Operating revenues about 12,000 a month and 1,000 8, well ahead of last year. We're seeing a lot of milk sales, and as you know, that's pretty good because all of our lunches and breakfasts are provided cost to students this year. Operating expenses about $98,000 for the month, $559,000 year to date. These $131,000 for the month, $600,000 year to date. That's where we are getting our revenues from the federal and state government that make up for not charging students for breakfast and lunches. So overall, the income before $6,000 for the year to date, and that's much better than last year. List of payments for the cafeteria, about $20,000 last board meeting, and we have another, I want to say it was about, sorry, I can't read it because it's about $13,000 year to date. I'm sorry, about $13,000 that will go out the door tomorrow. Parker Middle School activity funds. We had not a whole lot of receipts. We had some big for the class of 2028 and class of 2029. And were disbursements for fundraisers that those classes do during this time of year. High school, not a lot in terms of dollars, but you can see there a few $1,000s of receipts and only about a little over 1,000 in disbursement. That's all for the financial reports. Any questions?
Good question. Have you heard anything back yet? I'm sorry. Did I interrupt you? I just had a question about bowling. There's a lot of money in bowling. Do we have bowling?
We do have.
It was $2,600. Where do they bowl?
I believe they go to St. Francis.
Okay.
for the most part, and possibly other, other things.
Thank you. Good. Hope sport never goes away. All right, quick question. Have you have any indication this might help with lunch programs next year, or is it a deal to get us through this year?
What we know is that the current and the ability to run what they call the seamless summer option, which allows us to provide the meals at no cost. Those will continue through this. We don't know beyond what they will do, but we did receive notice of another federal program that with the supply chain issues, and yesterday it'll be available through that program as well.
Thank you. And
okay.
I don't think your question.
Okay, I'm going to repeat that question.
He's going to review the question, Luke.
Mr. Lofgren was asking for the class of 2028 and the class of 2029. The disbursements were to purchase for fundraisers for those two classes, and the majority of that money was
Any other questions for Bill? And if there are no, I'm sorry, do you have a question? Okay, no other questions or comments. Approve the financial statements, reports, accounts payable for disbursement as the cafeteria accounts payable.
So moved.
Andy seconded. Any other discussion? All aye. Opposed, same sign. Motion passed. Thank you, Bill. Appreciate it. Moving on to committee reports, policy and co-curricular committee, Mrs. King.
Thank you, Mrs. Farr. The committee recommends a motion to approve a second and final reading of the following school board policies: Policy 0, local board procedures, and Policy 903, participation in board meetings, and NC.
Discussion? All in favor? Aye. Opposed, same sign. Motion passed.
The committee recommends a motion to approve first reading of the following school board policies: Policy 610, purchases quotation; Policy 611, purchases budgeted; Policy 626, federal fiscal compliance; 6, personal necessity leave, and outlined in the directors received and reviewed copies of the policies at the February 9th study session.
That's the first reading. Was there a second on that? Did anyone have any discussions? It was the first reading. Now's the time to scrutiny. I'm sorry, I didn't realize the committee met about that. I was. Okay. Thank you. Any other questions, concerns? All in favor? Aye. Opposed, same sign. Motion passed.
The committee recommends approval of the 2021-22 athletic supplemental tracks as
Discussion? All in favor? Aye. Opposed, same sign. Motion passed.
Committee recommends consideration of approval of 2020 athletic supplemental contracts as outlined in A through C.
Second. Discussion? All in favor? Aye. Opposed, same sign. Motion passed.
The committee recommends consideration of approval of athletic volunteer assistance as outlined in A through C.
Second. Discussion? All in favor? Aye. Opposed, same sign. Motion passed.
Committee recommends consideration of approval of academic supplemental contracts as outlined in A through C.
Second. Discussion? All in? Aye. Opposed, same sign. Motion passed.
The committee recommends consideration of approval of field trips A and B.
Discussion? All in favor? Aye. Opposed, same.
The committee recommends for consideration of the approval of the health and safety plan as outlined in B. The updates were communicated at the February 9th study. And it's effective February 28th. The mask optional approach will be.
Discussion?
Have communications about.
Yeah, the question was regarding communications to families. So there's a detailed letter that's going to go out. We'll explain if it's approved tonight, what that means, the date, and the detailed language that's in the health and safety plan that I shared.
Thank you.
Any?
That concern be in the minutes. I didn't want to drag the board through anything else. I just wanted to ask for a concern about the plan still involving masking. I got communication or something from the education department that indicate that masking required by schools might not be legal. I mean, it's not, but it might not be legal. So I just wanted to have my concern about that so that I can go ahead and vote for the plan change without having that noted on my concern.
I'm sorry.
Can you clarify that for us, Luke?
I didn't work the motion and an amendment and all that kind of thing, but I wanted to ask that be captioned. I had a communication from the Pennsylvania Ed Department. Mask might not be legal. Our current plan is making it optional, but to the superintendent and pandemic coordinator to potentially reimpose them. I just wanted to be concerned that they might.
Okay.
I thought we left it open, we would bring it up again if it changed. How we left it.
I believe that we can revisit as a board, but we are giving the power to Dr. Lane and the pandemic coordinator significant situation to do something. And I was just, again,
Yeah, what Luke is saying is obviously correct. In that there's language in the plan that hasn't changed, it has been there from the beginning, that notes that upon the recommendation from the pandemic coordinator and the superintendent, that the plan could change. That's not new language, that's always been there. I believe what you're saying, approve that plan with a note in the minutes, noting your concern about what could possibly change in the future.
I've not voted for any other plan, so I'm voting for this plan to vote for this plan. So I just wanted to.
Got it.
In the latitude, that Dr. Lane will make adjustments whenever, if you something different. Okay. Any other discussion? Dana, could you grab a microphone for her? You can have as many as you want.
My only question was, do we know or is it outlined in the plan of how the communication will come or in what format look for in when you would change the plan? Like
that is not outlined in the plan, but it would have to be comprehensive. I mean, it would have to change, like communication would have to be extensive. So we would use every resource available to do that. And no, that is not outlined in the plan.
So it's not like a daily. I just want to make sure it's not written that it's going to be daily or weekly or anything like that. Thank you.
Linda, did you have another question? Okay. Is there any other comments or questions from the board? All right. Any other comments or questions that we had a second? All in favor? Aye. Opposed, same sign. Motion passed.
The committee moves for consideration of the PDE e-signatures resolution as outlined in A and B.
Second. Discussion. All in favor?
Aye.
Aye. Opposed, same sign. Motion passed.
And that concludes my report.
Thank you, Mrs. King. Finance and Operations, Mr. Lofgren.
Thank you, Madam Chairman. Take my food. All right. Item number 1, the committee moves to approve the 2022-2023 Erie County Technical School budget as outlined in A and B. Includes general being less than last year.
Discussion? Favor? Aye.
Aye.
Opposed, same sign. Motion passed.
The committee moves to approve the attached reimbursement resolution for project costs, which will allow the district to reimburse itself with a maximum of 15 of bond proceeds for cash outlays associated with rooftop HVAC units, roof replacements, fuel storage tank upgrades, Erie County operations, and miscellaneous capital projects.
Discussion? All in favor?
Aye.
Aye. Same sign. Motion passed.
The committee moves to ratify the following non-instructional employee resignations outlined.
Discussion? All in favor? Aye. Opposed, same sign. Motion passed.
The committee moves to approve the following non-instructional as outlined in A through D.
Discussion? All in favor? Opposed, same sign. Motion passed.
The committee moves to approve the following non-instructional employee resignation with intent to retire. Nancy Ekstrom submitted a letter and will resign effective the end of the school year.
Discussion? Make a comment. She changed our system to any other discussion? I know.
Yes, she's done a great bus system.
Any other discussion? All in favor?
Aye.
Opposed, same sign. Motion passed.
The committee moves to approve the change of shift as outlined in A.
Discussion? All in favor?
Aye.
Aye. Opposed, same sign.
The committee moves to approve the following individuals for the non-instructional substitute employee call list as outlined in A through D.
Discussion? All in favor?
Aye.
Aye. Opposed, same sign. Motion passed.
Number 8, the following non-instructional employee hiring outlined in A through C.
Discussion? All in favor?
Aye.
Opposed, same sign.
The committee moves to approve the following non-instructional employee hiring as A through C.
Discussion? All in favor?
Aye.
Aye. Opposed, same sign. Motion passed.
Number 10, the committee moves to ratify the following non-instructional unpaid leave of absences as outlined in A through E.
All in favor?
Aye.
Opposed, motion passed.
The committee moves to approve the following non-instructional unpaid leave of absences as outlined in A through C.
Discussion? All motion passed.
That concludes my report.
Thank you, Mr. Lafgren. Curriculum and Instruction Committee matters. Mrs. Miller, are you comfortable with that?
I think I didn't hear what you said.
I just want to be sure that,
I did it last time.
Lean on Brad. Yeah, get closer to the microphone and
Okay.
lean on Brad for advice.
Okay, here we go. The committee moves to approve the consideration of ratification of addition to the 2021-2022 substitute teacher list as outlined in A. Do I have to read all of it?
Great.
Okay.
They leave you hanging with the second sometime. Thank you, Mr. Ickes. Discussion, I'm sorry. Discussion? All in favor? Aye. Opposed, same sign. Motion passed.
The committee moves to approve the consideration of ratification of intermittent FMLA leave as outlined in A through C.
Discussion? All aye. Opposed, same sign. Motion passed.
The committee moves to approve the consideration of ratification of long-term substitutes at General McLane School as outlined in A through C.
Discussion? All in favor? Aye. Opposed, same sign. Motion passed.
The committee moves to approve the consideration congratulations, as outlined in A.
And if we don't mind would you mind, go ahead, when someone serves us with giving
Yeah,
all the
this is impressive.
information.
As a teacher, I look to this person and go, holy cow, congrats. Mrs. Pamela Mikowski, General McLane High School, has notified the board that she intends to retire at the end of the 2021-2022 school year. Mrs. Mikowski will retire with 39 years of service.
Oh, yeah.
We have to do the whole.
I guess. Is it offensive when we vote no? Because I'd like to know. Sometimes it's okay. All right. Then enthusiastic. Okay. Was there any other discussion? She said we're not allowed to. Okay. No. Is there any other discussion? Thank you for service. I'm sure there's going to be a lot of acknowledgement through the next year because we all know, and then Dan, we're all going to get him tissues because he's going to cry a lot. Thank you, Pam. Okay. Any other discussion? All in favor? Aye.
Aye.
Opposed, same sign. Motion passed.
The committee moves to approve the consideration of approval of update to 2022-2023 school year as outlined in A.
Discussion? All in favor? Aye. Opposed, same sign. Motion passed. Thank you, Mrs. Miller. Moving on to the other reports, intermediate unit number 5, Mr. Patullo. Yes, sir.
The Intermediate Unit 5 Board met on January 26th. Have 2 new board members. We have from Girard, Joseph Mecca replacing Bob Snyder. From Harbor Creek, we have Dave Vienna replacing Christine Mitchell. Both of those individuals stepped down. We had some personnel items, 2 retirements, 6 resignations. There were 17 new hires, 2 were new positions. All the others were replacing retirements or resignations. The lights in the IU building are all now LED, saving an estimated $600 a month. That cost was paid for by a grant, the 21st Century Grant. We watched a video on the migrant education program as presented by Deke Showman. And the budget, obviously we talked about that. We had a meeting yesterday as a preliminary, received the preliminary budget. I believe Matt and Bill have a version of it now. You both do, and we'll be voting on that next month. Preliminary budget, the next meeting is on the 23rd, next Wednesday. So once the board votes to approve the preliminary budget, enter a 30-day public comment period, and I'll send an email out about that. So after that, there was a grab and go meal. It was sandwich and some strawberry shortcake. The sandwich was pretty lame, 1 piece of meat on it, but the shortcake was delicious. That concludes my report. Thank you.
Mr. Patullo. Dr. Wise, Erie County VOTEC.
Can you hear me?
Not quite.
Am I doing this correctly? Can you now?
Lean a little and you have the most beautiful voice. Use it.
I attended my first school board meeting. I had been on the campus for quite some time, and I'm unlike Professor Patillo. I cannot give you a diet because I was told to be there at 6, and the meeting begins at 6. I would had to have been there. So next month I'll be able to tell you about dinner. I've served on both boards, and I have to tell you the food is much better at the Tech than it is at the IU. I should. You approved our share of the budget, which is $40,000 less than it has been. If the entire budget is on file at the Education Center, if our enrollment at the Tech has been decreased. Well, I don't know if it's good or bad, but that is the circumstance. Much is going on. It's underway. The director took us through his whole, and for moving programs around, so construction can go on. What is going on? So programs are being moved and put in different places so that entirely new wings and entirely new programs and laboratories can be built. This will take 3 years over this period of time. Beyond that, I will report next time on food as well.
Just real quick, if you're our guest, we're not silly. Many of this board, you have to be an ambassador or to go on other boards, and since obviously we don't get paid for this board or any other board, it's kind of a running joke that we at least the meals that maybe we were served when we go in these other committees. So we're not trying to be silly. Internal joke, I think.
We're also thankful for the food Sarah gives us.
Yeah, that's true. Sarah. Dinner. Mr. Lofgren, Legislative Council.
Thank you. So the big news this time of year is always the budget, and the governor has put out his vision for what. I was not on the board at the time during the excitement. Can you hear me now? Can you hear me now? Can you hear me now? Okay. I was not on the board at the time of the excitement of the cuts back with some previous administrations or some. But right now, this budget reminds me, and this is me giving a little bit of my own opinion. So I just be careful to say. I'm reminded of that period because a very large increase was proposed, and I'm not clear where that money will sustainably put. So I just don't want people to get their, and again, opinion on my part, but I don't want us to get their hopes up too much for a huge increase, because I'm a little worried that if we got that huge increase, then we'd turn around and be really hurting because it went away. So yes, I appreciate the demonstration of education is important. Let's get a lot of money, but I just want to be careful that we get money that we can continue to get consistently year after year. So that's the focus for my report this month, and I appreciate your attention, and that concludes. I definitely number it is. I think we need to be careful about taking it. So.
Thank you, Luke. General McLane Foundation, we had a meeting in January. We had another one in March. There is nothing to report for the month of February. Their business. No? Okay. If there is no other business, we will have recognition of visits for school-related matters. We do have we have a few, I'm sorry, we have several speakers. And so now this is where you have 3 minutes, and we're going to stick to the 3 minutes motion that I made earlier about policy number 3 and time limits, but we are going to stick to the time limits that the policy does require, and that would be 3 minutes. So first we would ask Carrie Swain, Finances and Proposed Budget. Oh, yeah. think I said we have a number of them.
Thank you. Can you hear me? Okay. Carrie Swain, 4941 East Avenue, McCain, Pennsylvania. As I stated in my first board meeting when I was first here in August, the discussion to promote transparency of interpretation that can be complicated for items that are yet simple, and be passionate about the school district, but in turn, these things can create animosity and hostility in the community if it's withheld. The 3-point last week that was announced and the suggestions to decrease are serious. Many in the community have no clue this is the current situation we're under. It's concerning as a community member, but GM stated this year their cyber program because they're from parents. Yet you want to create one and now help with the deficit. Not create one before for our students that need it, that left for cyber in the charter schools. Now we have to pay approximately per child to attend those other cyber and charter schools. I asked for these specifics, but I was told I needed a right to know. A right to know how many the district that we're paying for General McLane to go to those, that should be public information. However, in 1 year, with all the ESSERS funds we've received, how is this allowed to happen? Board members, do you review what's presented to you in depth? Do you fear to ask those questions? Do you understand the answers that are coming to you on a monthly basis of where this money is going? This is unacceptable for that outrageous and states because the last 10 years you used up what was in there, and list the top 3 reasons why it has to be. You had 10 years to think out of the box to create a solution to receive. I've asked Summer to record these board meetings, and even you stated that it was not recommended advice of the solicitor. The solicitor wrote a letter saying you could record these meetings. They would not be formal. The meetings would be formal. Yet you stated no. Once again, not transparent. The audience does not receive everything being reviewed by the board. We sit here questioning, asking questions. We finally understood that per policy 903 public participation in board meetings, we are to receive everything you review for study sessions and board meetings in front of you. That is email to. Thank you so much for doing that and taking your time to do that, Sarah. I appreciate that. The Fairview has a beautiful website you can look at if you need display of everything and how they. It's one of many I've researched. I attended the cyber board meeting. This is why. This is why I'm here today, because you stated as GM, you would be masking the unvaccinated and not masking the vaccinated. That was segregation. That was not fair. That's why I turned on in June to listen to the Zoom study session. And that's why I'm here today. You're now proposing a test to stay for unvaccinated. However, it may go away with option 3.
Carrie, I'm sorry, I did not. Good morning. So if
okay, no problem.
But now let's just start now a little over, but please go ahead.
Yeah, just have a last sentence. I trusted the medical side before I got sick, and I trusted the school board. I still trust you, but I just want you to stand for choice. Choice means not approving a field trip regarding vaccine card. Don't want the kids to be segregated. These love this school. They are scared to death to talk back. Do not want to be reprimanded at the school by the students or the teachers or the staff. I stand for choice, the choice for hard work. We as community stakeholders,
we're right there, Carrie. I hate to
keep transparent, keep working hard.
Thank you, Carrie. Mr. Fro. Sorry. I just know. And then Olga Kuffer. I'm sorry, Kiefer. I apologize. Olga Kiefer, to discuss finances. Yeah. You want a minute?
Oh, that's okay. Again, just wanted to again recognize Mr. Bill Fendia. I know he has put a lot of time into all of. I wanted to recognize Mr. Fendia for putting time and all the work that he did on putting together the preliminary budget. I did want to just maybe mention a few things that really did not sit well with me, and that was anything about cutting out athletics or non-instructional activities. You guys are not. The reason why is because as hard as it is on our children right now after this so-called pandemic, coming out with all these mental disabilities, and I'm speaking from a personal experience, child to the very same program in your school. I know my nephew had issues. So again, I want to share maybe a little bit of my little personal glimpse, how much it has helped my child grow from a little boy to a man, and how much it has helped my nephew, his very troubled family, how much these sports, staying after school, having different peers, communicating with each other, not having these troubles, how much it has really grown them in a positive way. You simply just cannot take it away from them. I also wanted to share that if whenever this new health and safety plan in effect, please communicate this to the rest of your youth wrestling team. Of course, we're very proud of them. I am mom of 3 wrestlers, so my oldest one, they just had a very significant win in the last duels. But I wanted to let you know, please support these programs, because this is where your pride comes from. This is what GM is known for. This year, it was very hard to communicate with parents because we weren't allowed to congregate in by the wrestling room because of the so-called COVID. I'm not going to be politically, tolerant. However, I want to let you know, we don't only have wrestling room, we have other activities within our schools, like the Little League. Please allow parents to come and watch our children, how well they're doing. If you could, please allow us, again, see our kids, new parents as well, when they come to these sections, they bring their kids in good faith. They don't know coaches. They don't know other parents. They feel awkward. So we need to communicate with each other. So I would really appreciate if you look into that. And again, please support the youth athletics as a little base for your next step, for your junior high, high school. Again, this is what GM is known for. So I just really wanted to reiterate. I know the debt didn't accumulate over just a few.
We're right there, Olga.
Okay.
One more sentence. I don't want to cut you off.
I know the debt didn't accumulate overnight. There are serious considerations. I am looking at more of a payroll costs, especially mental counseling. Again, we are hiring a lot of people from Barber Center, Achievement Center, spend a lot of money. Again, I'm hoping that, again, current health and safety plan would get us there. It wouldn't tie our hands down, but again, it would free us and it would free these children from these kinds of issues that would require additional costs. Thank you.
Thank you, Olga. Mr. Mark Kernick, regarding finances.
Mark Kernick, 12290 Angling Road, Edinburgh, parent. This is a great community that has many excellent parts to it. Neighborly people, the best pizza places, lots of delicious bagels, skiing and snow, plenty of unique family-run small businesses, a university that looks like it's actually sticking around for a while, fishing, boating, and kayaking. The school district can be a part of the community, but it is not the community. The bottom line is the school district needs this community way more than the community needs the district. I've seen firsthand the other educational options out there, and they aren't all that bad. I agree with most that in-person learning is the best option when done properly. However, there are plenty more options to come. The district is on a path to take families who are against school choice and rightfully turn them into advocates for school choice. The ability to take your child and your money and go to a better school district will start to sound very appealing. If the following behaviors continue in our schools, divisiveness, unprofessional statements of personal opinions, clearly one-sided propaganda, segregation type activities and policies, limiting in-person education, and failing to support the core ingredients to a healthy school system, which are families, students, and teachers, you will see a mass exodus from this district unlike one you could ever imagine. You see, the people that are here love this community, and they will continue to live here, but they love their families more, and they will quietly send their children elsewhere. So before you become enamored with many distractions and hitch your wagon to the people who like to say, go ahead and take your kids and leave if you don't like it here, you really should consider how divisive that attitude is. And if you want to be on that side of the argument that makes families choose the other options. I think the school district, specifically the school board and administration, have both a responsibility and a tremendous opportunity right now to stand out in a positive fashion and make some course corrections. Your job right now is to successfully answer these two questions for all families, which includes current and future families. Why should your children go to school at General McLane? And how can we make that happen? If you can achieve this, you all will be viewed as a great success. Remember three things. It takes all types of people working together with all kinds of strengths, weaknesses, and opinions to be successful. This community is here to stay, and you need this community, these teachers, these students, these families, way more than they need you. Thank you.
Thank you, Mr. Kurnick. Appreciate your comments. Jacob Kurnick, no topic specified. Jacob, you take your time, and if you think you need to start over or anything, you do what you want to do because we're interested, okay? It's hard to get up there. You do anything you want to do. Stand on a chair, whatever.
Yeah, I'm really small for this.
Yeah. Oh, he can hold the mic. Would you like to take the mic off and hold it?
That probably would be a little easier.
Sure.
I guess I'm just too small to even talk. Well, it's better.
Never.
I'm less nervous. Hi, my name is Jacob Koenig. I live at 12290 Angling Road. It broke my heart to see kids not even being able to talk because a thin piece of fabric was on the mouth, just because it helps COVID. Masks sacrifice people being able to talk clear, make kids be out of breath for something that hardly works. And I like going to the school. Teachers are nice, and they keep getting nicer, and they keep getting better every year. And that was the last year. Everything wasn't as bad. I haven't gone to school this year, but my brother is going to school currently. My parents chose online schooling for me, and they made a good choice. I may not see kids my age as much, but the pros outweighed the cons heavily. And I would like to go back to school and see children's faces. I would also like to not suffocate at recess from playing and wearing a mask. Yet again, thank you for removing masks, for making them optional. And have you ever thought of this? Let's say you walk into a supermarket, you get COVID on your mask, you finish shopping, COVID multiplies it. Let's say you didn't find everything you needed at the first shopping mart. And the COVID falls down and the process repeats. And though I am a kid, I'm getting pretty fed up about this, but thank you for removing masks. This ends my speech. Hopefully you enjoyed it. And by the way, I made that all myself.
Good job, Jacob. Thank you for your participation.
Got one more.
Um,
One more online speaker.
Can they
I don't know. Jeremy's gonna try, and I just bumped her up to 11.
give us just 1 second, folks? We want to talk Should I?
Yeah, see if she's there.
Kathy Bradley, can you hear us? We have one
I
more
can.
speaker who's participating via Zoom and wanted to have the opportunity to speak tonight. We're looking for Kathy Bradley. And I'm hoping that if I say it pretty soon, she's going to hear me.
Can you hear me? Can you?
Yes. Give us 1 second.
Can you hear me?
Kathy, can you hear me?
Okay, I have you off. Can you hear me now?
I can hear you. Can you hear me?
Okay, I can. Yeah.
Okay, we need you, we're going to put the mic closer to you. Just, I don't know if you heard what we had said earlier, name, address,
Name,
and
name.
we're going to get
Yep.
3 minutes. I'll stop you if we need to, all right?
Absolutely.
Sorry.
Hi, my name's Kathy Bradley. My address is 5134 Cindy Lane. I have worked for the district. I work at one of the elementary schools, and from the beginning this past fall, I have heard from the kids, and I hear from them every day. I hear about how they can't breathe, and I know that you've already voted for this, but please keep this in mind. And with all due respect, I implore you to come and see the kids, listen to the kids, not just have your degrees and say that I have this, I do this, or whatever, but come to the schools and listen to them. And they will tell you they can't breathe. The masks are dirty. And by lunchtime, they're nothing more than a dirty napkin. And I change them out all the time. I've seen them put them on the walls of the school outside and then put them back on their face. Kids who were finger suckers now suck on the mask. So I am thrilled that it's going to go mask optional. Trust me, the day that, I mean, literally right now, I'm in tears for that, to see their little faces, because they will be so happy. We have had days in the nurse's office where they have been down for headaches because they could not take a mask break for inside recess. Oh, I mean, we have a child in kindergarten who doesn't know his own last name. It's February. He couldn't make out the sounds. We worked with him down in the nurse's office. We took off our masks. We have children out on the playground in 3rd grade who have no social skills of their age limit. They have the social skills of kindergartners. Our kindergartner social skills are those of preschoolers. This is how far back our kids are. There's no way that we can make that up. There's no way we can make it up to them. And trust me, we are trying. We are trying so hard. All of our teachers are trying. And we as educators and teachers and staff have felt like we have failed them. And every day we still make it back into the building, but we don't know what else to do for the kids. But we are talking about it, and we help each other, and we back each other up. And it used to be a time when we would put kids first all the time, regardless of age, rank, gender, whatever. We put kids first. Now it's about auntie, uncles, elderly, but not our kids. What are we supposed to do with them? Every day, I implore every single one of you to come to these kids and see them and listen to them. And I will leave you with this last thing, and I know my time's almost up. Where I grew up, they are dealing with the 3rd death of a teenager from depression. This is where we are going. I don't want our kids to be there.
We're at the end. I don't know what to do. I'm sorry, Kathy.
No, you're fine. You're fine. I'm done.
No, that's a glitch. I apologize. That was a glitch. Yeah, I saw, Kathy, if you were listening, we had a little bit of a glitch with time there, so I do apologize. Okay, that is the end of our speakers, correct? And yes, right? And notifications of meeting held since the last regularly scheduled board meeting of January the 19th. We had a regular monthly study session that occurred on February the 9th. We had policy and co-curricular activities committee subcommittee on February the 9th as well. Is there a motion to adjourn? All in favor? Aye. Thank you. Right, good.